Hey, what's up? My name is Dr. Calvin Brown. I'm the clinical director for Simply Implant Institute. And we have Ali over here. He is from Arizona Anesthesia Solutions, all right? It's a company, arguably one of the best we've ever worked with, okay? They're great. Our patients love them. I mean, we just cannot, I'm telling you, we cannot do our institute any type of surgeries without them. So I just wanted to say, I want to say thank you. Listen, you know, you have a lot of experience working in a variety of environments, whether it's hospitals, private practice, etc. What is one of your major concerns about as far as working with offices when it comes to sedation?
Yeah, I mean, the number one priority is patient safety.
Okay.
Right? And so we want to make sure that we're doing everything here that we would do if we were in a hospital or in a surgery center. So we make sure we have all the right equipment, right supplies, everything to make sure we keep the patient safe, comfortable, and well taken care of.
We know, I like that. And let me say this, we here at SI, one of the things we do is we actually train for speed. All right, and right now we're in a faculty training weekend where we're going through a variety of techniques, etc. How important is as far as training for speed when it comes to, let's say, working in a practice setting that may be a little bit different than a hospital?
Yeah, I mean, under anesthesia, speed in an office is very important. I'm on a committee at the dental board, and that's one thing that we do is review bad outcomes and bad cases. A lot of professionals, a lot of leaders from the dental community that are on that committee. And really, a patient under anesthesia in a dental chair, it shouldn't be longer than 4 hours, 5 hours tops. You don't have catheters. I mean, you don't have to start putting diapers on patients. You know, and then on top of that, pressure. You know, for somebody to be laying still in a dental chair for an extended period of time, you get into a spot where you're jeopardizing patient safety. So being fast, being efficient, getting the job done, that's huge. I mean, if you're taking longer than 5 hours to do a case, you need to break it up or maybe find something else to do. You know, and it's okay if you need to split the procedure, do it in 2 visits instead of 1, but you got to keep that time down.
Yeah. No, again, I think that's really important because that's one of the things we really hear stress at SI. You know, the gentleman is also holding the camera right now. He and I joke all the time that if you're really going to take more than an hour to 3 hours and sometimes doing these full-mouth cases, we actually talk amongst ourselves that maybe you really should not be doing them, okay? I think it's very, very important, too, that in an interview like this, because, you know, we have heard of situations. Actually, let me ask you this. Have you ever heard of or been around any situations where procedures only take maybe 2 or 3 hours to take in 4, 5, 6, or 7 hours?
Sure.
Okay.
Yeah, and, you know, when those sorts of things happen, us as anesthesia providers, we start cracking the whip. We start saying, hey, this patient needs to wake up. So you need to finish whatever it is you're going to finish, and this case is over.
I like that. You know what? One of the things I did with my man right here before this weekend started was I was telling him that these procedures are going to take basically 3 hours or less. And I think, as from a doctor's standpoint, from an anesthesiologist's standpoint, I think this is very, very important because if you're doing a procedure where it's taking 5, 6, or 7 hours, then I think there's actually a training issue that needs to be resolved, okay? If you're interested in learning procedures that involve, you know, advanced surgeries, implants, extractions, etc., I think the SSI Institute is very, very important because, yes, we'll train you the right way. We'll train you about restorative, but speed and precision is just as important from a medical standpoint. And so in doing these procedures and keeping our patients comfortable, I want to thank Ali from Arizona Anesthesia Solutions because, again, without him and his type of services, these are the types of things that we just cannot do and keep our patients comfortable. So I want to say, as director of the SSI, Dr. Calvin Brown, thank you very much.
And one thing to add here.
Sure.
I work with lots of dentists. If you're looking for top quality instructors, SII is the place to go. Dr. Brown, Dr. Chapman, these guys do an incredible job. And it's great for us at AZAS to be part of it. So thank you.
Glad you're a part.
Absolutely.
Thank you very much. All right.